That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B or C which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25. You hear part of a conversation between a doctor talking to a patient. Now read the question.
Good morning, Ms. Williams. I understand that you've been experiencing some concerning symptoms lately. Can you tell me more about them?
Yes. I've been experiencing abdominal pain and diarrhea, and it seems like it's been happening more and more often. I've also noticed that I'm losing weight unintentionally.
I see. Those are common symptoms of inflammatory bowel disease. Have you noticed any changes in your appetite or bowel movements?
Yes, actually. I've been feeling nauseous and haven't had much of an appetite. My bowel movements have also been irregular.
I see. We'll perform some tests to evaluate the presence of the disease and determine the cause of your symptoms. It's important that we start treatment as soon as possible to improve your quality of life and prevent complications.
Okay, that sounds good. What are the treatment options for inflammatory bowel disease?
The treatment options for inflammatory bowel disease involve managing the symptoms through medication and therapy. We may recommend medications to manage the inflammation and reduce the risk of complications, as well as therapy to improve your quality of life.
Now look at question 26. You will hear a part of a speech given by a healthcare professional. Now read the question.
Good afternoon, everyone. Today, I want to talk to you about the link between nutrition and mental health. As a registered dietitian, I believe that what we eat plays a significant role in our mental health and well-being. Studies have shown that a diet that is high in fruits, vegetables, whole grains, lean proteins, and healthy fats is associated with a lower risk of depression and other mental health conditions. These foods provide essential nutrients, such as omega-3 fatty acids, B vitamins, and antioxidants, that help support brain function and reduce inflammation in the body. On the other hand, a diet that is high in processed foods, sugar, and unhealthy fats has been linked to a higher risk of depression, anxiety, and other mental health conditions. These foods are often low in nutrients and can contribute to inflammation in the body, which has been linked to an increased risk of depression. In addition to the nutrients found in food, the way we eat can also impact our mental health. For example, skipping meals or restricting calories can lead to low blood sugar levels, which can cause irritability, fatigue, and mood swings. Additionally, consuming caffeine, alcohol, and other stimulants in excess can disrupt our sleep patterns and contribute to feelings of anxiety and restlessness.
Now look at question 27. You hear part of a conversation between a nurse and a patient. Now read the question.
There are several medications that can help manage the symptoms of rheumatoid arthritis and slow the progression of the disease. Non-steroidal anti-inflammatory drugs, NSAIDs, can help relieve pain and reduce inflammation, while disease-modifying anti-rheumatic drugs, MARDs, can slow the progression of the disease and prevent joint damage. Biologic drugs, which are a newer class of medications, can also help reduce inflammation and slow joint damage.
Are there any side effects to these medications?
Yes, some medications can have side effects, but we'll monitor you closely to ensure that any side effects are managed effectively. Some NSAIDs can cause stomach upset or bleeding, while MARDs and biologics can increase the risk of infections. We'll work together to find the medication that works best for you while minimizing any side effects.
Okay, I understand. Is there anything else I can do to manage my symptoms?
Yes, stress management techniques, such as deep breathing, meditation, or mindfulness, can also help manage the symptoms of rheumatoid arthritis. Getting enough sleep and maintaining a healthy weight can also help improve your overall health and reduce the severity of your symptoms. We'll discuss these options in more detail and develop a personalized treatment plan that works for you.
Thank you. I appreciate your guidance and support. Now look at question 28. You will hear a part of a speech given by a healthcare professional. Now read the question.
Good day, everyone. Thank you for joining me today to talk about the benefits of manual therapy techniques in physiotherapy. Manual therapy is a hands-on approach to treating a wide range of musculoskeletal conditions, including back pain, neck pain, and joint pain. It involves various techniques, such as massage, joint mobilization, and manipulation, to help alleviate pain and improve mobility. One of the key benefits of manual therapy is that it can help reduce pain and inflammation. Massage, for example, can help increase blood flow and release tension in the muscles, which can help reduce pain and improve mobility. Joint mobilization and manipulation can also help reduce pain by restoring normal joint function. Another benefit of manual therapy is that it can help improve joint mobility and range of motion. When joints become stiff and restricted, they can cause pain and limit mobility. Manual therapy techniques can help loosen up the joints, improve mobility, and reduce pain.
Now look at question 29. You hear part of a conversation between a GP and a patient. Now read the question.
That sounds like a good plan. What about medications? Do I need to take medication to manage my condition?
Yes, in most cases, medication is necessary to manage coronary artery disease. We will work together to develop a treatment plan that may include medications to manage your symptoms and reduce your risk of heart attack or stroke.
Are there any side effects to the medication?
Some medications can have side effects, but we will monitor you closely to ensure that any side effects are managed effectively. It's important to manage your coronary artery disease to avoid health complications such as heart attack and stroke.
Thank you. I'm willing to make changes to my lifestyle and take any necessary medications to improve my health.
That's great to hear, Mr. Bryan. Managing coronary artery disease requires a multifaceted approach, which includes making changes to your lifestyle habits and taking medication. It's important to work together to develop a treatment plan that suits your needs and lifestyle.
How long will I need to take the medication?
Now look at question 30. You hear a part of a conversation between a healthcare professional and a client. Now read the question.
Hello, how can I assist you today?
Hi, I have been prescribed a medication for my condition, but I'm a bit worried about the side effects. Can you tell me more about them?
Of course, it's important to be informed about the medications you're taking. Which medication were you prescribed?
It's amitriptyline for my chronic pain.
Amitriptyline is used to treat depression, anxiety disorders, and chronic pain. Its potential side effects may include dry mouth, drowsiness, dizziness, blurred vision, constipation, and difficulty urinating.
Those side effects seem a bit scary. Do they occur often?
Not necessarily. The occurrence and severity of these side effects vary from person to person. Moreover, side effects might improve over time or after reducing the dosage.
What are the benefits of taking amitriptyline?
The main benefit of amitriptyline is to alleviate your chronic pain. The medication works to adjust the levels of certain chemicals in your brain, which can improve your mood, relieve your pain, and help you sleep better.
That sounds helpful. Are there any long-term side effects?
Prolonged use of amitriptyline can lead to weight gain, diabetes, or heart disease. However, these effects are rare and usually attributed to long-term use at higher doses. That being said, it's essential to discuss your concerns with your doctor before making any changes to your treatment.
Okay, thank you so much for explaining the benefits and potential side effects of amitriptyline. I will talk to my doctor before taking any action.
You're welcome. Don't hesitate to come back if you have any questions or concerns in the future.